I'll do a room scan first.
Hi, I'm Will, and this is my Indwelling Catheter redemption video. And let's begin. Hi, I'm Will. I'm going to be your student nurse today. I'm pulling this by privacy. Can you state your name and date of birth?
Joseph Smith, 10-5-54.
Perfect. I'm going to scan your ID. Boop. And I'm going to raise the bed right now. So what we're going to be doing today is we're going to be inserting a indwelling catheter, and I'm going to ask you some questions. We're going to do an abdominal assessment, and then we're going to insert it. Does that sound good?
Yep.
Yep. All right, perfect. And I have everything gathered. I'm going to give my alcohol swabs to my helper over there, and then I'm going to wash my hands to begin. And I'll wash my hands for 20 seconds. All right. There we go. And I'm raising everything above waist height for sterility. Alright, and to begin, it looks like the body size is average and it's big enough for our 12 French catheter. And do you have any allergies?
Sulfa and betadine.
Alrighty, so I won't be using the iodine swabs, and I'll just be using alcohol swabs. And do you have any history of surgeries?
Nope.
Nope. No GYN surgeries or any other procedures?
Nope.
Nope. All right, perfect. And do you have you had any catheters before?
No.
No. And so if you did, we would ask about any difficulties of inserting the catheters. Do you know the last time you voided?
Last night.
Last night. All right, that's been a little while. So we're going to be inserting this. And do you have any limitations in your joint movement?
Nope.
Nope. And then I'm going to grab the provider's orders, which I left out here. All right. So I got the provider's orders. I got to verify to make sure they're in active order. And it looks like it is an active order, so we're going to be placing that today. All right. And I would also ask the cognitive questions. Do you know where you are?
Southwest Tech.
Southwest Tech, and why are you here?
For my catheter.
And do you know what day it is?
Thursday.
Thursday. And they already stated their name earlier, and so that's the 4 questions. And then I'm gonna drape this. I'm actually gonna pull it back and do my abdominal assessment. And first I'm gonna inspect. I'm inspecting for color, size, contour, masses, bulges, lesion scars, striae, hair distribution, movement, and bladder distension. And it looks like they might have a little bladder distension, but that's why they're here. All right, then I'm going to listen to all 4 quadrants, starting with the lower left quadrant. I mean the right lower quadrant, my bad. Then we're going to go with the right upper quadrant, left upper quadrant, and left lower quadrant. And then I'm gonna palpate this time of the 4 quadrants: the right lower, the right upper, the left upper, and the left lower. And I didn't feel any masses or bulges, but a little bit of bladder distension. And if we were gonna use any aesthetic ointment, then we would put a little bit in the urethra before, about 2-3 minutes before we inserted the catheter. And now I'm going to put on gloves and perform pericare. and I didn't have a washcloth, so we're gonna pretend that this is my washcloth. And so we will take each corner. You would take the first corner and do the labia furthest from me, and then I would go to the other corner, do the labia near to me, and then take the last corner and go down the middle. And the urethra meatus is right down the middle, and the urethra is between the clitoris and the vaginal orifice. And then I'm gonna perform hand hygiene. This is soap, so I'm gonna wash my hands again real quickly. And then I'm just gonna do the normal hand hygiene that I was supposed to do. Alright. And then after that's all good and dry, I'm gonna set up my sterile field. Throw that away. Hold this closer. And then I'm gonna open up away from me first, then the sides, and I got the 1-inch border all the way around. And then I'm gonna get rid of these gloves that I don't need. Put them over there. I'm gonna get rid of this that I don't need. And then I'm gonna pick up this by the corner. I gotta find the actual corner of it, which is down here. I'm gonna only be touching within the 1-inch border. I will put the shiny side down. Oh boy, hard to tell which side's the shiny side. Alright, I think this is the shiny side over here. And then we're gonna lay it down there, just like that. Now I'm gonna put on my gloves. Take it out there. Look at that. Open it up. I'm going to pick up the inside of this cuff. Oh, come on. Oh, yeah, turn it around. Wasn't in the thumb. The thumb was hiding from me over here. Boy. Alright, and then we're gonna pick up this one and put my hand in there. There, now I can touch my glove with my other glove because they're both sterile. I'm gonna get rid of that real quick. And then I'm gonna sort through this and get rid of the stuff I don't need. I don't need those swabs. I don't need this right now. If I was collecting a specimen, I wouldn't need that. And I'm just gonna get rid of this too. And then I'm gonna open the lube before I take that out. Wrap it around my finger. Let's see if I can get it in here. There. Put it in there. And I'm gonna get rid of that. I'm gonna hook up the water for the balloon. And then can I have help with this? Alright, I'm going to sacrifice one hand first. And then I'm going to get the swabs. I'm going to do the far labia first. And the near side. And then right down the middle. And then I'm going to bring over my box. I'm going to place it right here. And then I'm going to insert it. And when I insert it, you can take a big deep breath to help. And just carefully go right in. And once I'm in there, I will see urine flow, and when I see the urine flow, I'll go a little bit farther in to make sure I'm in the bladder. And then I'm gonna fill up the bladder. Then take it off. Then I don't need to be sterile after this anymore. And it's in there. Give it a good tug. And then I'm gonna put the bag on the frame of the bed. And the difference between male urethra is that the male's a lot longer than the female, so you'll have to go in further. And to put it on the leg and the inner thigh, you would put it where there's enough slack, and then up a little bit more so it doesn't hurt them. And then you place that right on the hip, and then you would wipe off any lubricants or anything that would be on there. And then if to collect a urine sample, you would clamp it shut, clamp the tube shut, and then wait about 15-30 minutes, maybe not 30 minutes, 10-15 minutes, and then you would take an alcohol swab, swab the port, then you put a Luer lock syringe on, then you put it on, and then take out your urine, put it in the sterile cup that I threw over there, and then take it. Then you would initial it, you would date it, time it, and the patient of who it is, and then take it to lab. All right, and then I'm gonna clean up everything, and I would put the patient in a comfortable position, and I would have asked them if they were in a comfortable position before we started to put the catheter in too. I'm just gonna clean up everything.
You have like a minute and a half.
What?
You have like a minute and a half.
Okay. That should be enough time to clean up. Alright, now I'm gonna lower the bed. Now it'll help them in a comfortable position if they do need to get in one. Now I would perform hand hygiene after I took my gloves off, and I'll make sure the bed's low and locked, and I'll put the table right next to them too. Give them the call light, make sure the floor is free from fall risk, and then, is there anything else you need from me?
Nope.
Nope. All right, perfect. Thank you for letting me put that in you, and bye now. All right.